Hello, thank you very much for joining. We have got a wonderful guest, Dr. Dilip. He's the president of AMA Association in Queensland. Um, and not only that, he does wear a lot of hats. And even after continuing and completing his term, he's going to be involved at different levels to help the community, help doctors, and help the medical industry move forward. Thank you so much, Doctor, for joining this chat today.
Thank you, Tanya, for inviting me.
Yeah, I wish I could have a chat with you at better situation and better times. Unfortunately, it's completely different. It's out of all our comfort zones that we're having this conversation. Anyway, I have few things that I wanted to talk to you and get some understanding, and that's why I thought this is very useful to hear it from the right person. um, we have had, really been successful in containing and making sure our curve is flattened. But the last week, we still had few cases here and there. Are you concerned about it?
Tanya, we are living in a very lucky country in Australia. Especially in Queensland, where we live, we were one of the first to declare the pandemic emergency as early as the 23rd of January this year. And at that stage, immediately preparations began for what we didn't know was going to happen. And what we feared was going to happen hasn't happened. And the preparation that we actually did was to immediately work towards doubling the emergency department and trebling the intensive care unit availability in the public hospitals, as well as try and protect the private industry. And by private industry, I mean general practitioners and plastic surgeons. Now, we've done very, very well. And as you can see, the figures are less than 20 per day. And I suspect that they will continue to drop. And that is why the government is actually releasing the brakes on social distancing. In Queensland in particular, we've had at least 5 or 6 days in the last 10 days that we've had 0 cases identified. And a couple of the cases that we've actually had actually came from interstate. So we are doing particularly well in Queensland. Now, the cases that you are talking about are a couple of clusters that we have in an aged care facility in New South Wales and in an abattoir, in a meatworks in Victoria. So those are the cases that are coming. They're cluster cases. And I think that what we're going to find in this next phase is we're going to have to tackle the clusters rather than a large-scale community breakout.
I see. I understand what you mean. And do you think when we get more Australian citizens has been stranded elsewhere and they return, there's really high likely possibility that they could have the COVID. So in a sense, we may not completely be 100% out of COVID. Is that right to say?
COVID will be with us for a long time, and it also will depend on whether we are successful in creating a vaccination or some medical treatment that will combat COVID. And as you know, billions of dollars of research are going all over the world. And the good thing about COVID is that the scientific world is actually working together to come to a solution. So whilst there's a race to develop treatments and probably a vaccine, there is shared information, which is unprecedented. Normally there's a lot of intel and IP involved, but there's a fair bit of shared information going on in this work. So until we get to that phase, we're going to always have COVID infections going on. And I guess what we now have to prepare ourselves is for how do we deal with these isolated clusters, because there is evidence of community spread. And how do we actually deal with these clusters without actually affecting the economy of the whole country generally? And this is what the government is actually trying to do based on medical advice.
That's right. And recently there's a 7-year-old boy also who was tested positive. On Monday, the schools are going back. Should we be worried, or should we just...
Well, schools is a very vexed situation, as you know. Similarly to the 7-year-old boy that we've had infected here. There was a 9-year-old boy who was infected in France who actually contacted 170 people. And there's a study that's come out of France that none of the 170 people actually got infected from the boy. So we don't actually understand clearly why there's such a low risk to children. Is it because of their heightened immune system that they're clearing the virus more quickly, or are they very low transmitters of the particular virus?
Yeah.
So one of the issues is schools, and it's coming up more and more whether schools are safe. We've heard the teachers' arguments that they feel a little bit vulnerable, and I think that's valid arguments as well. But what we're trying to do is to see whether, in view of the very low transmissibility in children, the medical advice in Australia, coming from international studies as well, is that it's safe for children to go to schools. What the reason for the closing of the schools in the first place was they didn't want community movement. There's thousands of people move every day to take their children to school and to pick their children up to school, and we were trying to stop that. But now that we seem to have the pandemic under very good control in Australia, what the authorities are telling us is that it's safe to return to school, and we are trying to minimize measures when parents are dropping children to school or picking up children to school, parents not mixing with teachers, etc. So those kind of precautions will be taken out on the pavements and outside the schools. And in the schools, the requirements of social distancing, the requirements of sneezing etiquette, coughing etiquette, and using sanitizers, hand washing, etc. needs to continue. So on that basis, the government is allowing schools to start resuming, and each jurisdiction is doing it differently at the present time.
Yeah, that's spot on. It's actually going to be a next way of life for the next few months, of course. And and I'm comfortable. I'm happy to listen to the authorities and take the instructions. My kids are going to school. So, you know, when we talk to different professionals and different business owners and stuff, there's a general notion that medical facility and medical industry is safe. And it actually surprises and amazes me because, as you know, I'm in the medical industry. I do own medical centers and we run medical business. So I do not believe that is the case. We are not immune. And apart from emergency services, really, the rest is suffering. What do you think? How it's going to be the comeback? Is it going to be easy or?
So you make some very valid points, and if I may just reflect on some of the earlier things that you said in your statement just then. First of all, the medical industry is regarded as an essential service, especially when there's a pandemic and there's public health issues at stake. And it's very sad when you sit back night after night and watch your television news from international, and you watch our colleagues who are working in frontline actually succumbing to the disease and are dying, not only from the disease itself, but from the stresses that they have actually come to. And in fact, some of them are taking their own lives, unfortunately, because of the mental health stress that they're actually undertaking. And I find that very disturbing, and so should we all. However, we are doctors, and therefore the community expects us to actually respond in the way we are currently responding. As the press are calling us, when we had the bushfires, the fire brigade workers and the firemen were called the heroes of Australia, and now they're calling the medics and nurses, the medical people and the nurses, the heroes of Australia, because we have to front up and we have to look after the sick people. So that's the first part of it. The second part of it is the business. It's really strange that more and more I'm finding that Australians and even politicians and local governments don't realize that medicine is a business. We all run small businesses. And in fact, I recently had a meeting with the mayor of Brisbane, and he was surprised when I actually said to him that we actually are small business people, and we are feeling the pain as the same as restaurant owners and small retail outlets and small businesses as well. So it's pretty strange that as small businesses, that we now actually have to look at what are some of the measures the government is putting into place to help small business. Because doctors traditionally don't have to succumb to those social security type of issues that the government is putting in the packages. We know that the Commonwealth government is doing a lot as far as trying for us to secure our staff, and most of us secure 2, 3, 4, 5, 6 staff who totally depend on us as doctors for their livelihoods, and they all have mortgages and they all have children to take to school as well. So we want to secure our staff. Then we've got the private hospital sector where the surgeons are being prevented from doing their surgery, and there's thousands of nurses, thousands of ward orderlies, theatre orderlies, all dependent on activity. So we are a business. Community doesn't see it as that way, but I think one of the things that COVID has done is actually made people realize that we also run small businesses. Now, to come out of it, it's going to be as difficult as small businesses has come, because, for example, in general practice, we have seen almost a 40% drop in people attending general practices because of the fear of contracting COVID. Category 3 and non-urgent category 2 surgery has been stopped in private hospitals and in public hospitals. And most of the surgery done in private and in public hospitals in private hospitals is category 3 and non-urgent category 2 surgery. So there's hundreds and hundreds of specialists and surgeons who actually, A, are not getting referrals from GPs because of the downput, and B, are having to put their staff off, close their surgeries, and wait for surgery to commence whilst they're earning no income at the moment. So it's a very difficult situation from the medical business point of view, Tanya.
Totally. And the dental colleagues, it's really much needed discussions, isn't it, in the dental industry, and plastic surgery, cosmetic surgeries, things like that. The specialty, the niche area, the list actually goes on. And even I believe in those kind of non-urgent or non-emergency kind of procedures, even after the restrictions being eased, whether people would be able to afford those sort of service, and that affordability can in turn affect the procedures and the functioning of the small businesses, if you like, the dental and the related plastics and cosmetic and all that industry. It is a major concern. How long do you anticipate this kind of slowing down in the medical industry would continue?
So there's two issues in what you're saying. We're picking up the subspecialties like dentistry and cosmetic surgery as well. As you know, the dental procedures are all aerosol producing, and that's the highest risk as far as spread of the COVID virus, because as it is, dentists and plastic surgeons, etc., will take every precaution in every surgery, whether we've got COVID or not. And that still stands. We've got the highest infection control principles and standards that we have to abide by. But then when we've got aerosol producing procedures, it makes it very difficult. And that's one part. The second part of it is the ethical dilemma, because these procedures need a large volume of personal protective equipment, PPE. And right now, Australia does not have enough PPE, despite the reassurances that we are getting from the government. We have three problems with PPE in Australia. We have poor communication about PPE.
Right.
We have lack of transparency of the quantities of PPE. And we've got poor, what I call PPE stewardship, in that is the right PPE being used all the time for the right procedures?
Right.
And until we can sort that out, and even though we've got the guidelines, this has not been consistent. And so the people who are using PPE for high-risk surgery, or what we may call not urgent surgery in some dental procedures, some plastics, etc., the dilemma also comes down to, do we need to save our PPE for surgery that is much more vital and much more needed. The other aspect you made is very important as well, and that's the financial aspect. We've seen the queues at the Centrelink. We've seen the number of people that are losing their jobs. We've seen our unemployment, they're forecasting, will be over 10% very, very shortly. And if it wasn't for the JobKeeper allowance that the government is actually giving, most people would be actually struggling even for the bare essentials in their homes. And we are such a lucky country that we actually can afford to get the JobKeeper allowance. And I think after the recovery and when the business is open again and people resume their jobs, they will have deferred bank loans, deferred mortgages. And I think some of those things naturally are going to take priority over aesthetic surgery or dental surgery or something like that. So you're right. Some of the niche specialities are going to take a long time to come back, I think, yes.
Yes. I heard from a doctor colleague that in even the high-risk areas that, like clinics and specialized clinics, the guidelines, there was some kind of ambiguity in the PPE, wearing of PPE. So you take a swab. In my understanding, you take a swab, then you got to dispose that PPE going to another patient. Is that right? And you take a swab. You can't be wearing the same PPE going from one patient to another. I'm a little bit confused about that. So if there is shortage of PPE, how is that going to work? So one patient to another patient, you've got to keep changing the PPE. And if
as far as sorry, go ahead.
Yeah, if we have to keep doing that for any kind of procedures for the next few months at least, so the lack of or the shortage of PPE is definitely worrying.
Yeah, so PPE, the further dilemma to the shortages that I've actually told you is the way it is actually being distributed in Australia. The state governments have taken responsibility for supplying the PPE for hospitals and their hospital-run fever clinics, okay? The Commonwealth government, on the other hand, is now supplying the private sector through the primary health networks, which we call the PHNs. The PHNs are distributing PPE to general practices and to pharmacies. However, the sector that is not getting the PPE and who have been forced to source their own PPE are the private specialists, the non-GP specialists. They're not getting a distribution at the present time, and most of the non-GP specialists are having to purchase this. And to me, that's a danger because the quality of the PPE varies, and where the supply is coming from is also an issue. So we haven't got it right, Tanya, as far as PPE is concerned. And until we've got larger volumes of PPE with guaranteed supply, I think we're going to find some of these surgical restrictions are going to be continued in this country.
I understand. I get a bigger and broader picture of the situation. Thank you. That's really helpful. And I'm hoping with some of the travel, the speculations or hope that New Zealand and Australia buddying up to do the travel, opening up the travel and stuff. Hopefully some of the tourism and related entertainment business and stuff between the two countries will be alive again, and hopefully things would come back to slowly normal, at least between the two countries. And is that what you're hoping for as well? Is that what we're anticipating?
Yes. So politicians have to also look at the social impacts of what's actually happening to their communities as well. And as we know, New Zealand has done it as well as Australia. In fact, New Zealand are a couple of weeks ahead of us as far as the stages of opening up the restrictions for COVID. And they're talking about the Australia-New Zealand travel bubble. We've already been told that some interstate travel will only come in stage 3, which is in about 3 months' time. And we've already been told that international travel will probably not open this year. So how do we actually improve things? Now, we must remember also that the politicians know that there's 500,000 New Zealanders, or more than 500,000 New Zealanders who actually live in Australia. Okay. and we've got at least 75,000 Australians who live in New Zealand. Now, as a result of the social isolation that we put in and the countries closed their borders, these people haven't been able to travel to and from our two countries and have not been able to see their relatives, their family members, etc. So they've also been socially isolated from those family issues more than we have in Australia. The other thing is that if we've got a zero rate basically going on in New Zealand and we can bring our rates to zero and we actually confine travel between the two countries, almost like an interstate travel arrangement, more from the morale point of view, it actually will lift the morale, because after China, the most number of visitors we get from any country in Australia for tourism is New Zealanders, and vice versa. New Zealand depends on the tourism industry. It's winter time now. If you ask the mayor of Queenstown, for example, the ski industry, they totally depend on the Australian business and the Australian tourists. So these discussions are worth having. I'm not sure how close the politicians are to actually letting that happen. What would happen is that they come to that arrangement, then the need for the 14-day quarantine when we land in each other's country will be removed. And I think largely that is going to be depending on the information that they're going to gather regarding community spread in both our countries. And the Prime Minister is going to great lengths to make sure that the app that the government has developed is probably going to give us the answer about how much community spread is actually occurring and what are the links. Opening up the borders is going to make it harder to do physical contact tracing like what we're doing through the public health units. Whereas having the app will make contact tracing much better as well. So there's a number of things that dominoes have to fall into line, but I think the two governments are talking, and it will be a morale boosting thing for both countries.
I totally agree. Is there any final message for people in the business industry, in the medical industry, that you can give, any instruction, advice, or tip as we conclude?
So the AMA Queensland, the messaging that we've been giving to the communities are that general practice and non-general practice specialist surgeries are open for business. There was the initial lockdown, the social isolation, and the fear of contracting the disease if you left your home. Now, most medical businesses have done amazing work. The waiting rooms have been limited to the number of people that would arrive. All respiratory illnesses are scanned on the telephone before the patient is even allowed to present to the surgeries. All respiratory type of illnesses are being referred to fever clinics and are not being seen in the private rooms. There's social distancing in the waiting rooms where seats have been put aside 1.5 to 2 meters apart. Children's toys have been removed. Books and magazines have been removed. And doctors are doing everything in their power to make sure that when their patients come to face-to-face consultations, that they should not fear anything. In fact, it's probably safer now from catching anything in the doctor's surgeries than there ever was. So our message is medical practices are open for business. Now, where we've got vulnerable people who are immunocompromised or have comorbidities and cancers and chemotherapy, etc., a large proportion of their consultations could be done by telehealth. And what the AMA has been doing is to actually work with the government and has actually secured telehealth services. And so video conferencing is a very, very good way to do business. And I think it's going to probably stay for even the post-COVID way in the way we do business. So I think what we're saying to the community is we are open for business. Don't take chance with your health. We don't want to see a rise in deaths from non-COVID related conditions than from COVID related conditions. And I think the message is finally getting through, and the information that I'm getting as the president of AMA Queensland is that after the 40% drop in private practice, people are starting to get confidence to come back.
Thank you so much. You actually absolutely well and truly named everything, and the message was really spot on. Thank you so much for joining, and have a safe and healthy rest of 2020. Thank you.
Thank you, Tanya, and thank you for having me on your show.
Thank you.